Hi, this is Dr. Kang, the scuba diving story, and today I picked free diving after scuba diving. Is there higher risk of decompression sickness? I have personally translated SSI Freediving Diver Manual Level 2 and 3, and also Instructor Training Course Manual. I wonder if they are still using the same book. But when I was translating the book, I felt very uncomfortable because there were certainly some or many things that I didn't really agree. So today I will talk about free diving and decompression sickness. Is it rare? It has to be rare to talk about the next subject, which is scuba diving followed by free diving. Is it risky? Or you do the free diving first and then the scuba diving. Is it also risky? So we will take a look at that. Free diving and decompression sickness. Is it a reality? The mechanism that causes decompression sickness after scuba diving, which is high partial pressure of nitrogen coming into our body, it seems unlikely in breath-hold freediving, is the conclusion so far. Decompression sickness is about the bubbles in venous floor, call it the venous gas embolism. Can bubble be formed, and can bubble block the venous floor? If we pack our lung with a free diving way of breathing, let's say maybe we have about 1.5 liter of air in our lungs. If we go down to 20 meters, which is 3 bar, the volume goes to 1/3 of that, which is like 500 milliliter. That, how much of that can the nitrogen can melt into our body and form bubbles when you go up? How much air do we use in one scuba cylinder? It's a 2,250 liter, and we breathe them in the depth, and certainly the bubbles will form when we ascend. What about in freediving? So, is it a DCS symptom, or is it DCS symptom-like symptoms? We'll see that. Certainly, they show CNS symptoms in sea harvesters. We call them henya. Japan calls them ama. Spear fishermen using scooters. They stay down long. They go far and do a lot of fishing. And in freedivers doing the deep dives. Is that DCS? Certainly they have symptoms very similar to neurologic symptoms in DCS. But there is a very good reason to believe the symptoms come from some other either disease or condition. For example, you do the free dive, you have very little oxygen. Every time you do the free diving, especially when you come up, your oxygen is deprived. Due to extreme blood pressure change, there can be some bleeding in the blood, in the brain, I'm sorry. At depth, there can be some lung damage causing arterial gas embolism. Micro-injury to the brain that is repeated. Also, if you have any pre-existing small vessel disease, these can give you decompression sickness symptom-like symptom. So DCS symptom occurs only in extreme breath-hold diving, competitive divers, AMAs and handlers who has to do a lot of free diving to feed their family, recreational spear fishermen, poor divers. There is no symptom on the first day. If you free dive deeper than 66 feet, which is 20 meter, and do it for like 3 to 4 hours repeatedly, the symptom comes. Surface interval shorter than the dive time. This is very important. Is nitrogen accumulation a contributing factor? Does it suggest it's not really quite agreed upon yet. So there's some articles by Huggins in 2006. He detected bubbles in a dive to 154 feet, and he also breathed oxygen for decompression, but still he detected some bubbles in his in diver's venous channel. In 2010, a Japanese Corsi, he found some bubbles in AMA divers, sea harvesters. So there are some case reports, but existence or presence of bubbles doesn't necessarily mean DCS. Also, here's a very interesting case report. A free diver has done like 12 dives down to 60 feet. Surface interval each time was like 5 to 6 minutes, and 2 hours late, the last dive, he had the symptom of dizziness, visual disturbance, chest tightness, and numbness of right face, which is a typical neurological symptom of DCS. Again, he had a PFO. So PFO is considered as a very important factor in decompression sickness. So this particular case report is trying to say that the bubbles crossed over to the left side of heart and gave neurologic symptom of DCS. This still doesn't somehow prove that the decompression sickness actually came in freediver. In freediving, the surface interval is like 3 times longer than the dive time. Freedivers stick to this very strictly. If you dive deeper than 200 feet, only 1 dive per day, with some decompression procedure. We bring 100% oxygen down to 5 meters and you breathe from it. In freediving, the center rate is like 1 or 2 meters per second. It looks very fast. So we do a dive, we do a scuba dive, and then we do the free diving. Then somehow we still have some bubbles in our body. And free diving also gives us some bubbles. And if the ascent rate is that fast, can it give us some problem? That's the issue also. So far, the conclusion is absolute risk is very low for most freedivers. Particularly when conservative surface interval has been maintained. Symptoms, it's mostly CNS symptom. Usually symptom is very transient, so it goes away when some decompression procedure is done. Vertigo, nausea, vomiting, paresthesia, muscular weakness, paralysis, impaired concentration, lethargy, speech disturbance, altered level of consciousness, meaning you can lose your consciousness also. Uncommon musculoskeletal or joint pain, which is the most common symptom in scuba diving decompression sickness. This is a photo provided by Miss Kim, the SSI instructor trainer for freediving, which I thought was very nice. And I thought she was pregnant with umbilical cord. So, breath holder dives after scuba diving. It may cause redistribution of venous gas embolism, but again, the risk is very small. Still, neurological accident in extreme breath hold diving is rare. So, I think, and I recommend, if you are a scuba and free diver, scuba dive, and if you really somehow have to free dive, just don't do too deep. Then I think it's safe. But sorry, I cannot guarantee anything. It's my opinion. Sometimes free divers do the free dive first and then do the scuba diving. There's no standard recommendation so far. If you've done extreme free dive, like 60 meters, you're not supposed even to free dive, not to speak of scuba dive. So again, this I don't think is too big a risk if you don't do any extreme free dive. So I talked about scuba diving and free diving, and is there any possibility of decompression sickness after free diving? It's still yes or no, but my point is, unless you do some extreme deep dive, you may have symptoms very similar to decompression sickness symptom, but to conclude it is a decompression sickness, I'm not very happy with that. So scuba diving followed by free diving, the same thing. And also free diving followed by scuba diving has been talked about. So I think we should stay on the safe side. But if we have the phobia of something, it's even worse. So stay on the conservative side, but don't worry too much. I think I would scuba dive and enjoy some shallow Freedive. Thank you very much.